Welcome to our Wednesday call every single Wednesday, 7 p.m. Central Standard Time. Let's get right on into it. Let me start off. So every single week, you guys know I get a ton of questions that I write down and I go over for the call itself. So on here, what I look at is I look at the different things that agents are bringing up on a daily basis while they're in the home, sitting down with clients, talking with clients, and some things that is necessary to review. So one thing that I had a question on was states with no underwriting for Medicare supplements. So a lot of agents, they do travel, they do go to other areas, they go to write business, and it might not be your resident state. You might not be in one of these three states. We don't do business in New York, which is one of them. So there's three states that don't do any underwriting: Connecticut, Vermont, and New York. As of right now, right? And things change all the time. So if you just Google it, you can pull it up and see the different states. So in Connecticut, there's not going to be underwriting for Medicare supplements. Vermont either, and New York, we don't conduct business in. So you'll see that. And an important thing is so I lived in Connecticut for about like 5, 6, 7 years, something like that. And I lived over there and I didn't sell Medicare when I was in Connecticut. But it's good to know if you ever do go there. I know we primarily do Advantage plans, so take that note right there. Okay, let's go to the next one. The next one is TRICARE. Okay, so I want to talk about TRICARE and TRICARE for life. So what is TRICARE? So TRICARE is what you're going to get. So there's actually two different things that is kind of confusing for people. So it's CHAMP VA, okay, and then we have TRICARE. So those are two different things. So CHAMP VA is a VA program, whereas TRICARE is DOD, and it's regionally managed healthcare program for active duty and retired members of the uniformed services, their families, and survivors. Okay, so two different things, just so you guys know how it works. So what I'm going to focus on is TRICARE and how that works in combination with Medicare Advantage plans. So you'll run into it and you'll sit down with people that have TRICARE. And what do we tell them? I tell you guys this all the time. It's super important. So you can enroll in a Medicare Advantage plan, okay? But you got to bring both your cards to the doctor's office, your TRICARE card and your Medicare Advantage card. Anything that the MAPD does not pay, TRICARE will pay for those Medicare covered services. So anything that's Medicare covered service, TRICARE is going to pick up whatever's left over in terms of the bill. TRICARE covers prescription drugs, so you don't need to have an MAPD. Can you get one? Yes, you can have one. Okay. Use an MA only plan. So I would recommend doing that. And an important thing is that there is also givebacks. So you could have a great give back plan, the Humana Honor give back plan, that's going to absolutely be amazing and it's going to crush it. You're going to give them $1,200 a year. I mean, depending on the area, right? $100 on a monthly basis is a lot of money, and they don't have any medical bills, right? They just go, they hand them two cards. Hey, you guys worry about that. And I'll talk about billing in a moment. So use an MA only plan with a give back. It's going to provide those additional benefits such as your dental, your vision, and your hearing. You're going to get over-the-counter credits on a monthly or quarterly basis, but you could use it monthly, right? So you get over-the-counter credits on a quarterly basis. And I'm talking for people that are not necessarily on Medicaid, just for people on Medicare, okay? So that's important as well. So you'll see that on a quarterly basis, they're going to get $50 per quarter. That's an extra $200 you just put in that person's pocket in addition to the $100 a month on a give back, if we're just saying that hypothetically. Plan's going to come with $3,000 in dental, right? $200 in an allowance towards eyeglasses, right? So those are some additional benefits. It can come with a free gym membership, right? It can come with a free life alert, which they call personal emergency response system, PERS is what you'll see it as. So there's benefits that TRICARE is not going to have. And the issue is what it comes down to is the billing issue. Okay. But TRICARE picks up any cost that the MAPD doesn't for those Medicare covered services. Okay. So that's a huge thing for our clients, right? So if you sit down with someone, you talk to them and they're active, and they're going around, some plans even give them a free Fitbit, which is really cool. But you see that they're active, they're always moving, they're doing stuff where you just ask them, hey, do you exercise? Do you go to the gym at all? They're like, yeah, I go to the LA Fitness right around the corner. Like, perfect, me too. Right? I go to that same gym, love it. I've been going to LA Fitness since 2008, about 14 years. Favorite gym, been going there a long period of time, right? But good news is, just so you know, you don't have to pay for that anymore. That's actually included with your United Healthcare MA only plan. So you no longer have to pay for that. So they, depending on the company, they'll call it silver sneakers, there's different names for it, but they'll include those gym memberships, and they're all good quality gyms, so they don't have to pay for it. So now you just save someone $34.99 a month or more, right? Boom. Also, the personal emergency response system. I mean, think about that. That could be another $30 a month you just save someone. So someone can't just tell you that they don't have money to buy other products that you're marketing to them, right? Hospital indemnity, life insurance, right? You could be marketing other products to the client as well, doing it compliantly. So another factor, just keep this in mind, they can get their drugs from TRICARE, right? I want to really reiterate that point. They don't need to pay for it, right? They can get their drugs right from TRICARE themselves. So that's really important. Generally, a PPO is just in general, right? We always love the PPO. So PPOs are always great. What does PPO stand for? It stands for Preferred Provider Organization, Preferred Provider Organization. And what that is we give you a preferred provider to go see. This is who we prefer you to go see, but you can go and see other doctors if you want. You just got to pay some more money. That's all. And then we have the HMO, which is a health maintenance organization, right? We maintain your health. Okay. We tell you where to go. You got to go in the circle. You can't go outside of the network. Otherwise, it's going to cost you a lot of money. In fact, you have to pay for full stuff unless it's an emergency if you go out of network. So in terms of flexibility, I would say go with a PPO for flexibility. Now, if we look on paper and we understand that we're competing against other agents that are going out there to sell Medicare Advantage plans as well, an HMO is always more rich. So for example, I have a client who is a trucker. He's on the road all the time. And he does not just stay in the state. He's not just working in the city, driving around, in Dallas, Fort Worth area. He's right now, he called me today. He's in North Carolina. He wanted to get some dental vision and hearing because he saw an advertisement from Humana on the TV, right? So he's actually driving around, and he just turned 65, I don't know, 6 months ago, somewhere in that ballpark. And for him, we're looking at the options. I'd explain the two and to say, hey, listen, you're getting original Medicare, right? But you're on the road all the time. So having a Medicare Advantage plan is good and you can do it, but I'd prefer if you had a Medicare supplement plan because of your occupation, because of what you're doing. So I don't just say to everyone, get Medicare Advantage and that's it. No, I have to describe the difference between the two products and see which one is the best fit for that specific person. So what it is it's subjective to each situation. Now, we know that since we're dealing with the final expense demographic, the final expense market, the lower income clients, we know that those clients, okay, are lower income, and generally for people that can't afford a premium, a Medicare zero premium Medicare Advantage plan is going to be best for them. Just as simple as it is, right? It's nothing complex. So that was just an example of that one client. Okay. So keep that in mind. I'm just going to do a little recap, and let's cover the billing real quick, and then I'll do a recap. All right. So for billing purposes, here's the issue. The billing is generally the main reason why someone who has TRICARE or VA, I mean, I guess you could say, right, something that covers prescription drugs outside of going with an MA only plan, right? So, if they're FEHB, the federal employees, health benefits for federal employees, they can also get it. They treat it the same as TRICARE. So let's just stick on that train of thought. Billing is always the issue, and that's the main reason why you'll get a complaint or someone will cancel and you'll get a chargeback. If a client enrolls in a Medicare and MA only plan and they are paying out-of-pocket costs that they didn't have to pay before, because TRICARE essentially operates like a Medicare supplement plan. There's no co-payments. They don't pay anything, which is why I say, hey, any bill that you get, you can send it over to TRICARE and they'll pay it. So don't worry about that, right? You shouldn't get any bills anyways, but the billing is the issue. Okay. So the coordination of billing is important. Some plans are better than that. And Sometimes it's not the plan. Sometimes it's the doctor's office, and whoever works there, maybe it's just a smaller office and it's only 4 or 5 employees, and the one employee that works in billing, they may not be well aware of this stuff because they don't see it frequently. And that little mistake could end up costing you money and the client canceling. So you have to explain everything I just mentioned in here up front, right? In addition, they're getting that $100 back on a monthly basis, right? So really go over all that stuff and just talk about that coordination. All right, so let me go to over here on just something I got from United Healthcare. Screen one, just share screen. And here you guys go. So here is United Healthcare. And sorry, let me just admit someone's in the waiting room. Okay. How do TRICARE and Medicare work together? So this is just uhc.com, and you guys can see the link. If you want me to send it out, I can most certainly send it on out. I'll shoot that on out to everyone. Okay. So basically, as we go through this article here, you could just read it, I'll let you go, I'll send it out to you guys and you can read it. But let's scroll down. So how TRICARE for Life works with Medicare plans. So TRICARE for Life may work with original Medicare Parts A and B, a Medicare Advantage plan, or a prescription drug plan, PDP. However, you may want to think carefully about whether or not you need Medicare drug coverage. TRICARE for Life includes a prescription drug benefit, so you may not need Part D if you have TRICARE. Okay, which we already talked about. It's creditable coverage, and you don't pay a penalty. So that's good to know as well. So we know, right, that you can use it in combination with the Medicare Advantage plan. So here you go, and you just read through this, okay? How Medicare and TRICARE for Life pay healthcare costs. When you have Medicare and TRICARE for Life, you can visit any authorized provider. But as mentioned before, in the US and US territories, Medicare will be the primary payer. So how do the two work together to pay your healthcare costs? The provider will file a claim with Medicare. Medicare will then pay the portion it's responsible for, and then the rest goes to TRICARE. Okay, so that's if someone has original Medicare. All right, now if someone has a Medicare Advantage plan, the Medicare Advantage plan is the primary. So TRICARE is always the secondary, right? They always pay last. All right, Medicare Advantage plan is now the primary. That pays first. TRICARE then pays secondary. So they pay after. So that is simple. And I think there was another one in here that I have, which is TRICARE. It's on their website. This is a government website. Maybe it is tricare.mil. I don't know if it's a government website or not. It doesn't say .gov. I don't know if TRICARE would have a .gov on their website or not. Not sure. Okay, so using TRICARE for Life with other insurance. If you have other insurance, such as Medicare Supplement or employer-sponsored health plan, you can use TRICARE for Life as long as you have both parts, Medicare Parts A and B. TRICARE pays last after Medicare or your other health insurance. That's what I was just mentioning before. I just want to show it to you back black and white. Okay, so here is the most important thing over here. Send your paper claims to WPS along with a copy of your provider's itemized bill, the Medicare summary notice, and the explanation of benefits from all other. So if there's paper claims, and I'm sure you can click that, I'll include this link in the one that I'm sending you guys as well. So you have both of them. So you could just read this. I have that handbook too that I sent out. That's from 2020. Yeah, it's probably 2022, the handbook. It's probably on here somewhere, actually. It's probably a handbook in here that you guys can get on this website. And you could read more about it to understand it. And just remember, the whole point of this stuff and these calls is to understand and have a deeper comprehension of how the things you're going to run into work while you're in the field, right? TRICARE is not something you're going to run into every single day. There's not as many people that are going to have TRICARE. You're going to run into that. So it's good to know how it operates with other insurance. Is there anything I could do? Is there anything I could sell them? And the more well-versed you are, the more you build rapport with the client through your words, the more you gain trust with the client through your words. So the things that you say that they already know to be true. So even if it's just something as basic as, hey, what is TRICARE? TRICARE is for the Uniform Services Healthcare Program for active duty members, ADSMs, active duty family members, National Guard and Reserve members and their family. retirees and retiree family members. Those are our clients that we're dealing with, survivors, and certain former spouses worldwide. So that's great to know. So you're like, oh, okay, great. So TRICARE brings together the healthcare resources of the military health system, VA, such as military hospitals and clinics, with a network of civilian healthcare professionals, institutions, pharmacies, suppliers, etc. So that is really cool, right? So now you're educated on what it is. And just like anything I do, I want to be the best at it. So when I sit down with the client, I'm talking to him about it, it's like, oh, well, someone's like, yeah, I have TRICARE. First things first, right? Thank you for your service, right? What branch of the military were you in? So something along those lines instead of, not understanding what it is. Let me go back to see what's next on here. Let's see here. Let me see if I had any other notes. Okay. Another thing that I want everyone to start considering is we are coming up on 2023. There's only 4 weeks left of AEP, right? So if you're running low on leads, we have final expense leads. There's final expense leads somewhere in the country that you can go see. I can guarantee you that we have direct mail. Okay. We also have the digital leads, the SEO leads that you can get, right? Try them. We still have some co-op money left. And I know I sent out an email. If you didn't get it, you weren't on the list, the co-op money, we give a discount on leads. You have to produce in order to get it, going forward. We give everyone a shot, obviously. Hey, we're going to give you some money. We're going to split the lead cost with you 50-50. So normally Medicare leads are coming in at $18. So it's $9 to you on the digital leads. So you can get those, or you could buy the direct mail as well. Direct mail right now, mail houses, most of them don't mail during AEP because of how bad the returns are. So either if they don't mail, then they just charge you more money. Either they don't mail or they charge you more money rather. So, but you can just get final expense leads because that's the same demographic, right? That's the same client. And you sit down and you talk to them and you're able to sell them stuff. So what I want people to start focusing on as we get towards the end of the year is the looking back at this year, right? And I say this every single year, Scott, you've heard me say it a million times, is this year you are a better agent than you were last year. This year you're more well-versed than you were last year. This year you're more educated than you were last year, right? This year you've sold more products than you did last year, right? This year you sat down with more people than you did last year, right? So it's all getting better and making progress over a short period of time. 1, 2, 3, 4, 5 years. 5 years is a short period of time, right? It's not a long period of time at all. And you build up a book of business of 1,000 clients in 5 years, which absolutely can be done. You're making $25,000 a month in renewals, right? Plus all the business that you're constantly getting that just comes from that, which is a ton. So at this point in the year, what you should be doing is focusing on your 2023 goals and the numbers that you need to hit in order to get those goals. So, hey, you know what? A lot of agents. So let's say, Christy, she's on this call. She does a phenomenal job. Brian, Mark, Jeremy, Lori. Well, Lori, you've been selling it before this year. Megan. So there's a lot of people on here that if they just started selling Medicare this past year, and if I didn't say your name, I'm just literally clicking through the top people I see on the list. If they just started selling Medicare this year, they're already a more well-rounded agent. And what that does is it's going to keep you in business for an extended period of time because of the renewal-based income and because the diversity within your business itself, right? So diversification is key. There's a saying in business that you should never let one single client represent a majority of your business, 80, 90% of your business. And in this case, right, for a lot of agents, right, they're 100% of their business is final expense. Oh no, what if something happens, right? So it's great to have that diversification. You're a better agent next year than you were before. So have that together and we can review it together. We could sit down and say, hey, what numbers do you want to hit? What's your goals, right? What's your short-term goals, right, on a quarterly basis? Because we can do different measurements. We can measure stuff on a monthly, quarterly, semi-annually, annually, and then we can review it 3 years later. Hey, this is what you told me. I looked at my goals from like 5 years ago. I have them written down somewhere in one of those drawers in my office. And I look at them, and one of my goals was make $10,000 a month. And I thought that was like a killer goal, right? Make $10,000 a month. I was like, that is, crazy. Right? Make $10,000. I thought that was amazing. But it's nothing. I mean, 10,000 bucks a month, that's not a lot. And it really isn't as soon as you start to break certain thresholds. I know to some of you, and I'm not disrespecting anyone, but I'm just saying, right? That was a goal that I had, and now I've far surpassed that. My thought process back then was so much lower than it is today. So today, when I look at applications, I would say to myself, okay, how do I write 100 apps? Well, being around other high level entrepreneurs, one thing that has taught me is add another zero to that. Right? Forget about 100. How do you get to 1,000? Oh, it's a big difference. Guess I got to buy a lot more leads and see a lot more people. Okay, well, then how do you get to 10,000? Well, I need a sales force of agents to help build that goal and get there and sell. So how do you do that? Well, I need to have a whole sales training platform. We need to have a contracting department, right? We need to have someone that can field the calls while the agents are in the home. So you have to reverse engineer every single thing. And then what I did, I mean, you guys go on my training and you see how I scripted every single video. I wrote every single video out and recorded every single one and uploaded it. Personally, I did it all. I wanted to make sure that everything was done perfectly to a T, so that way there's no mistakes or any errors, right? So I had to reverse engineer everything to get to where I am today. So that should be, hey, what's my objective? And then what's my strategy? So come up with that stuff and we can revisit. You shoot me an email and we can sit down and do it. We could schedule a 15, 30-minute phone call and we can do it together to make sure that we can go ahead and ensure that you hit your goals. And if you're not hitting your goals because of whatever reason it might be, right? If it's because of you and there's something you're doing wrong, something you're saying wrong, or if it's because of lack of lead flow, or if it's because of something I'm doing wrong, or whatever it might be, right? There's ways that we can solve everything and ensure that you're able to perform at the level that you need to perform at. So let me go over here. Mark said a question. I'm just going through the chat box real quick. If a client's PCP is not covered by a carrier's HMO plan, can we place that client with the same carrier's PPO plan? So that, yeah. So PPO, you can go in and out of network. So you just have to call up the doctor's office and just ask them and say, hey, for Unite Healthcare, do you take their PPO? I always just call the doctor's office just to make it easier. Do you take the HMO? Do you take the PPO? They say, no, we don't take the HMO. We only take PPOs. And most of the time you're going to see that the doctors that only take PPOs and not HMOs are generally, this is what I always see it with: mental health and pain management. Those are the two things. So like a psychiatrist and then some type of doctor that's writing prescriptions for painkillers. Okay. So Jeremy asked a question. He said, today I ran into someone who only had part A. Can they enroll in part B so I can? Yeah, Jeremy. Yeah. So they can always enroll in part B of Medicare. They just have to pay a premium for it. So one thing that we covered on last week's call, which was really, really great, was we covered last week that with a client, okay, if they're on Medicaid, that Medicaid will pay for the Part B premium and any late enrollment penalty that they might have for not having Part B. Okay. And the main reason why people don't have Part B most of the time, or Part A most of the time, is because there's a premium associated with it. So Part B, we know, no matter who you are, Part B, there's a premium. And I'm not going to get into IRMA, what that is. IRMA, you pay more money if you make more money. We're dealing with final expense. So with that said, it's $164.90 in 2023. Okay. So what does that mean? That means for our clients, they have to pay that on a monthly basis to have Medicare, Parts A and Parts B, which that will enable them to enroll in a Medicare supplement or Medicare Advantage plan. If they don't get Part B, you can't get it. The only thing you can get is a prescription drug plan. So with that said, if they're on Medicaid and they have Part A only, which I think one of y'all ran into it and we were talking to the client, we were able to help them out. Hey, you're on Medicaid. just enroll in your Part B of Medicare. And when you enroll in your Part B, Medicaid's going to pick that up. And that's full Medicaid. So someone that's full dual eligible. And also, if someone's eligible for the MSP, the Medicare Savings Program, well, that's perfect. So the MSP will pay that as well. And if someone doesn't have Part A and Part B, and they're enrolling in it for the first time, more than likely they also don't have a prescription drug plan at that point in time, which you can use customer lookup in Sunfire or Medicare.gov to see if they've ever had one before. And what's the thing about Part D and them not having it? Part D, prescription drug plan. If they don't have that, then there's a penalty for not having that either. So now they got to pay a penalty here and a penalty there. But if they're eligible for those subsidies offered by the federal government, extra help, LIS, low income subsidy, LIS, and that's for your prescription drugs, or MSP, MSP Medicare Savings Program, or full Medicaid, right? Those government programs, federal and state level, they won't have to pay for any of those penalties or premiums. So it's a great thing to know as well. So to answer the question in short, yes. And John said, what does the health insurance card for TRICARE look like? No. VA identification card is completely separate from that. So veterans have a card, that's the VA card that everyone knows. It's a white card that's got their picture on it, and it's kind of like a driver's license, but for the VA. And then they also have a health insurance card from TRICARE. So what I can do is, I'm just going to Google it. I'm going to see if we can find one real quick. Showing your ID. Let's see if there's one on here. Here we are. All right. So I'm going to just screen share. I'm just going to show you guys what I found real quick. So it's going to look something like this. Let's go screen share, screen one. Boom. All right. So it's going to look like this. This is what I've seen. So it looks like this. So that's what you'll see when a client has it. So it'll be this white one right over here. So that's that. So you'll see that. And then they also have their VA identification card as well, for VA, Veteran Administration, Veteran Affairs. So they have that. Let's see. So that covers that stuff. Let me just go into my other notes over here. Another thing that y'all should be doing, that you guys know I am always doing, is making sure that I'm dialing my book of business. So I'll say this on every single call. Make sure you're checking the status of all your applications. Make sure you're checking to see if your clients are staying on the books. So here I got my notepad of all the clients that I have, you know, in 1, 2, 3, 4, 5, 6, 7, 8 pages of, you know, just Excel sheets that I just print on out. And I use Google Sheets, not Excel, but you guys know, same thing. So I have this stuff of all my clients, and the ones that are changing plans or the ones that are staying the same. And I color coded it, so I know who's changing, who's staying, etc. And some people who have passed away as well. So yeah, so I stay on that and I stay on top of it. So just make sure you're tracking your book of business to see if it's going down during AEP. Last year, how many clients did you have with your United Healthcare book of business? 100. Okay, what is it down to now? Right? Is it down to 70? Why is it down to 70? Right? Like, what happened? Did you not call or reach out to any of your existing clients before AEP? Are you not getting in touch with these people, sending them letters, sending them cards, talking to your client, making sure that they're staying with you and not getting sold on a 2.5-star plan, right? Because it looks good on paper. So that's important. So make sure that you're doing that. And the applications that you're submitting, Mark had one that we were talking about that was, it came back duplicate. So either the client's already in that plan or somebody already enrolled them in the plan that you're trying to enroll them in. So it's a duplicate application or duplicate, they already have the plan itself. So I've seen duplicate mean that both. I guess it depends what carrier. So just stay on top of that. And also, as we're going through it, right, we have to continue to make sure those clients stay on the books. So even though you've enrolled the client, every week or so, you know, you should be checking the status of those applications. and in the agent portals. Hey, is this inactive? Wait, what happened? Why did this become inactive? I just saw this client. I sat down with them 3 weeks ago. What's going on? Right? So make sure you're staying on top of that and you're tracking your book of business this time of year. So Scott, you got a question? Go ahead, buddy.
Yes, I was just affirming that you see those book of business coming off your list during AAP or after. In other words,
Always.
if you
all year round.
okay, thanks.
Yeah, so you'll always see that no matter what. So it's always going to be changing. Your book of business is always going to be changing. And since Scott said that, Scott had brought something up. Him and I, we were talking today, which is a good segue into, let me X out of this and share screen here. Go back to screen one. Yeah, so just make sure you're tracking your book of business. You know, if someone you wrote during the year, you'll see a chargeback, but you'll also see that they are no longer, they're an inactive policy. So you could just check that one and just see. All right, so we have, this is an article, I just Googled it, go to the top over here. And this is the Inflation Reduction Act. And this came out, this is 2022 Inflation Reduction Act for 2023. So this is the important part right over here. The Inflation Reduction Act limits monthly cost sharing for insulin products to no more than $35 for Medicare beneficiaries, including insulin covered under both Medicare Part D and Part B. Part B insulin is going to be the one that you have on your body. So it's we have what's called a self-administered drug, a pill or an insulin shot or an inhaler that's self-administered. And then you also have drugs that are not self-administered, that you don't give yourself, like an insulin pump, which will be covered under Medicare Part B. That's an insulin pump. It's not self-administered. You're not doing it. Or Christy and I were talking about there's shots in the doctor's office that a client gets, right? That's not going to be on a formulary. It's not a self-administered drug. So that would be under what they call Part D, which would be your MAPD, your Part D. So, and no deductible will apply. Now, here's the thing. Oh, let me actually keep reading this. All Medicare Part D plans, both standalone drug plans and MAPDs, will be required to charge no more than $35 for whichever insulin products they cover. Although plans will not be required to cover all insulins, for 2026 and beyond, the laws limit monthly Part D co-payments for insulin to be lesser than 35%, 25%. Okay, you guys get the point. So let's just highlight this part right here. This is really, really important. So yeah, it's $35 to do the Inflation Reduction Act. That is phenomenal. Anything that's for saving seniors money, I vote for it. You know, please do. It's the number one market that, you know, people are they're just taken advantage of. The government can just steal money from Social Security, you know, whenever they want. And the costs of Medicare, their healthcare cost goes up every year for people that are on a fixed income. I am anything that can help them out, I am in favor of most of the time, right? So this $35 for insulin, I think that's an amazing thing to do. But if the drug's not on the formulary, it's not $35, right? So that's an important thing for us to notate. It's not $35. If it's not on the formulary, it's not covered. I mean, what can we do? Nothing. You can do what's called a formulary exception, meaning you can have the doctor request a formulary exception saying, hey, I need this drug. That's not something you want to do for every single client, right? It's more of a headache, and it's a process that if it gets denied, right, we're not going to do an exception for this drug. We're not going to make an exception on our formulary, which is our list of drugs, okay, to add this drug in and cover it at the same cost of $35. It's just too expensive for us, and we don't have a cost to handle that. So Jeremy, why would someone be on MAPD and PDP plan? I don't know what you're asking there, but if you're asking why would they be on MAPD and PDP plan, you can't. You can be on one or the other. So I'm not sure if that's what you mean by that, but you can be on one or the other. You can't be on both. So with that said, I also want everyone to make sure you're tracking this, make sure you're staying in contact with your clients, send them out cards during AP. I have letters that I did today that I am going to start sending out to you guys. I have a referral letter. I have an enrollment and a plan letter. This isn't my final version, so let me just, I'm going to show you guys just an example of what I've done here. But this isn't my final version. This is one of my edits that I have going on. And let me go ahead and hit share. So, dear so-and-so, congratulations on applying for your new plan. We're so glad you chose us. To find your new plan, we're working hard to finalize your application, help transition from your previous coverage at this time. And like I said, I'm going to edit this, but just so you guys know, right, this is kind of what I'm doing. And I'll get to the fun stuff at the bottom. At this time, there's nothing else you need to do. Our team will reach out to you if we need any additional information. Have any questions, call me and put your cell phone number there. We hope you enjoy the extra benefits and cost saving features of your new plan can provide. Below, you'll find details, blah, 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 blah. And then here's what we're going to do. Important, please keep this document for the records. Applicant's information, the insurance carrier, their plan name, coverage effective date, licensed insurance agent, application ID, application status. So that can say pending, that can say enrolled, it can say whatever, right? So that's something that is short and sweet. I mean, look at that, it's one page, but what it does, as always, right, is this stuff validates who you are as an agent. Okay, so that's pretty cool. So I like that. And I always want you guys to be able to have these and these letters that I've been developing. Like I said, it's AP, so I'm really busy, but I've been working on them. Here's my other one. This is a T65 letter to your existing book of business. You guys know I talk about all of the mail too, right? So what just happened? Zoom quit unexpectedly. Send a Zoom. Second. Are you guys still on the call? Mute. Hey, it disconnected on my computer screen. Can you guys hear me?
Yep.
Okay. Thank you, Joe. I appreciate you. You're the man. So I don't know where I left off, but what I will show you here is my other letter. So I'm assuming everyone saw the other one because it just cut out. The other letter, I'm going to go to this one, T65, and then I'll go back to the other one for a second. So congratulations on turning 65. I've been reaching out to folks who are turning 65. There are many decisions you will be making relative to your health insurance, and I would like to offer my help. I spent many years educating consumers on the various options available to help them manage out-of-pocket healthcare costs. I can do the same for you. One option you may wish to consider is a Medicare supplement plan. These plans are designed to pay whatever Medicare doesn't pay according to your chosen plan. They're also designed to be hassle-free, no bills, no paperwork, and no networks. You can keep your doctor and have coverage if you plan to travel or move out of state. I represent many different plans, and I need logos in here. So I got to get back with my assistant to put the logos in there to make sure you are covered and make sure you got the lowest premiums, suit your specific needs. Helping people navigate the many healthcare options in retirement is my job. I would be happy to meet with you to explain basics of Medicare and discuss your individual situation. If you or a family member is eligible for Medicare, please call me to set up an informational meeting to discuss your options, blah, blah, blah. Okay, so you guys get the point. So that's one of the letters over here. Hold on, let me go. There we go. This was the enrollment letter, and I don't know if it cut out or not when I was looking at it. So I'm just going to show you guys this again. So it's just short and sweet. Congratulations on your plan. Let me know if you need anything. Here's the plan that you're getting enrolled in. Here's your information. Here's the insurance company, the plan name, coverage effective date, licensed insurance agent, application ID, and application status. So this just solidifies, hey, I wrote this plan on up, and you input all of the client's data in here. So we can make that, and I'll send that one out to you guys. What's the other letter I wanted to show you guys? Oh, here, hold on. Let me just see. There's one more referral letter. Okay. And then there's a referral letter as well that I want you guys to see too. And then I'll go back in the chat for questions. So like I said, I'm going to edit this, but this is a referral letter. And basically the gist of this letter is to kind of say, hey, well, I'll read it. As you know, our mission is to help seniors live confidently and age gracefully, blah, blah, blah. We are continually working to educate the community about the services that we provide. However, it's often difficult to get this information to everyone. And what does that mean? And that for you guys as agents, that means that there's some people that just aren't going to send in a lead, but you know that they need help, right? Or they're in a bad situation. They're paying $100 a month for a Medicare Advantage plan, and they just never send anything in because they think they got everything taken care of. So that's just crazy to me. So we'd like to ask for your help in this endeavor. If you know anyone who could benefit from our services like you have, simply give one of our cards attached, which I'm going to edit that, to the sheet and name on it and send it on over for a free assessment. We look forward to providing the service. So what I'm going to add in here, like I said, these are just rough drafts for my assistant and I that we've been working on to get this stuff out to you guys. So that way we could go ahead and get these letters sent to clients and start generating more revenue off your existing book of business and just stay in front of them, right? Because if you don't, someone else will. So that's a very, very important thing. So let's look in the chat box and see what's going on. Sorry, let me just scroll up. Okay, so Jeremy, sorry, I'm just reading through the thread real quick. So Jeremy said a regular MA plan and a PDP. No, you can't be on an MA only plan and a PDP. Yeah, like John said, you run into a private fee for service, but you're never going to see that at all. I mean, the probability of you seeing it's very, very low. So the answer is no, you're not going to have an MA only plan and a PDP. They're on an Aetna PPO plan along with the PDP plan. Yeah, no idea what you're talking about. If they enroll in an MA plan, they're going to be disenrolled from the other one. So, and it's done automatically through Medicare. Joe said, Jeremy, look it up on medicare.gov and see which is active. What I found was people hold their PDP cards. Yep, that's true. And they kind of just hold on to that. You'll see clients that have 10 different cards. Jeremy, how can I tell if the PDP is active? Yeah, I mean, medicare.gov or just use customer lookup in Sunfire. Customer lookup in Sunfire is going to tell you all that stuff. Same thing that we do for every single case with all of our clients. So those steps that we go through, right? That sheet, that PDF, we have that for a reason, right? If we follow all of those steps, we don't miss a beat when it comes to selling and getting all the information that we need, right? So if we just pull it on up on my website, you go over here and you just pull up the steps to sell. If you make sure that you follow all of these steps every single time, you'll know exactly what they have. So get the red, white, and blue card, get their current health insurance card, doctors and medications, or a specialist, get their prescription drugs, begin the Medicare worksheet, go to medicare.gov, input the information to Sunfire, and then in here, add contact, obviously, do the customer lookup, and then enroll them into a plan, and then complete the health assessment and all the stuff at the bottom. So with that said, right, if you do all that and you follow the steps, you'll know exactly what they have, and they won't have a MA, Medicare Advantage, PPO, and a PDP. As soon as they're enrolled in one, the other one gets canceled out automatically by Medicare. Alrighty, guys, it's 7:46 Central Standard Time. Does anyone have any more questions? If you want to raise hand, I can go to the chat box or participants rather. If you guys have any questions, let me know. I'll look to see if there's any text message. Joe, yeah, go ahead, Joe. Let me hit ask to unmute.
So quick question. So I'm out in PA blitzing, there's a pretty big network out here of Geisinger. There's a hospital, and they also have their own Medicare Advantage plans associated with their the network there. And apparently all the doctors have their own list of companies they take. Now, when I try to call the office, and they're a huge network, they just sent me to the generic billing department. When I spoke with them, they're like, yeah, you just got to check with the doctor. So when it comes to PPO plans, is it pretty safe to say that, okay, if you're going to put someone in a PPO plan because there's going to be some specifically rich benefits that they have, like out here, the OTC is crazy. And the Humana plan is going to be far superior than this Geisinger plan that she has. So is it, I never got, I guess, got an answer ultimately. So when I called them, they just kind of said, well, they're not in network Humana for them, but is it still safe to say if it's a PPO, they're going to be okay on that?
Yep. Yeah. So that's a great question. That's the whole point of the PPO for the preferred provider organization, is that way they can go in and out of network. They're just gonna have to pay a larger dollar amount. And some offices, I don't understand. And like I said, sometimes you're gonna run into smaller doctors' offices where someone can't give you a firm answer, or they say, I've heard this before, well, yeah, just bring in the card and then we'll try to bill it and we'll see what happens. And it's like,
Even for DSNP though.
Oh, for a DSNP?
Yeah.
Yeah, I'm not worried about anything. If it's a PPO DSNP, don't worry about anything. If the doctor's in and out of network, that client ain't going to pay a dime for anything. You are in perfectly good shape. If they're a PPO, so when I used to live in North Carolina, in 2018, we had a regional, actually, I don't know if it was our PPO or just a regular PPO. So let's just say it was a regular PPO. That was the easy, because it was the only plan. There was no HMO DSNP in that area that was commissionable. So they didn't want you to sell it, clearly, if something's non-commissionable. So the PPO plan itself, it was just, you could sell it to everyone because it didn't matter who their provider was. You didn't even need to check networks. They're on Medicare and Medicaid. Any bills that they get for healthcare is going to be paid. So if you spoke to your local rep in that area, that's essentially what mine had told me at that point in time. So yeah, so you're good.
So I just tried to do a customer lookup for that client that I was talking about, and on Sunfire, under enrollment history, nothing populates. It just says undefined.
That's weird. Yeah, so you could send me over the case details and I could take a look at it.
Okay. Yeah, because when I look them up on Medicare.gov, it shows it's an Aetna PPO plan, but for whatever reason, I can't even view the plan details on Medicare.gov, and I've never had that issue before.
Yeah, if you're trying to look for 2023, it could just be that they don't have the plan anymore for next year. They got rid of the plan. So that could be one reason.
But do they have, I mean, just to answer this, ask, is he seeing this PDP plan that he's claiming that's there? Or that they're claiming?
Yeah. Yeah, I see that on Medicare.gov, if that's what you're asking.
Did you do customer lookup in Sunfire?
To date?
Yeah, I did the customer lookup on Sunfire. Yeah, and it shows the client's name, their Medicare number, and everything, Part A and B. But under enrollment history, it just says undefined.
Interesting. Yeah, get pictures of the cards, take pictures of it, and we'll do some more research and take a look at it. Yeah, so just bring me that information and we will see.
Okay.
So cool. Yeah, just send me over we look at the Medicare worksheet and stuff, and we'll get to work on the case. Cool. All right. So with that said, unions plans. Just reading the chat real quick, and that should do it. So I appreciate everyone. If we got case specific information, obviously we don't share clients' data and stuff like that. So if you have anything specific to clients, we'll bring that stuff offline. If you guys have any questions at all, just feel free to text me, email me. Like I said, I'm going to email you out the TRICARE information that we have, and use those resources, save those links, and that will save you a lot of time, and you'll become more of an expert and you get a lot more sales. So I appreciate everyone joining this evening. I will be talking to you all soon. Have a great evening. Thanks, everyone.